You are watching the Doctalk Show.
You are still watching the Doctalk Show, and today with Dr. Frank Asimwe, we are discussing the urinary bladder and conditions that affect the urinary bladder. So we've seen the conditions that actually affect the bladder, but Dr. Asimwe, what are these risks that predispose some people and not others to conditions that affect the bladder?
Okay, thank you very much. For infections, the risk is pretty much level for most people, but it gets higher in women, largely because they have a short urethra. So any microorganisms can easily go up. You see, we need to understand the concept of infection. We can be infected by very strange organisms, which are not on our body, but also when you have got organisms which are on one part of the body, getting to another part where they're not normal flora, as we call it, where they don't normally reside, that can cause infection, and it's in a couple of stages. There is contamination, then there is colonization. They have to grow to a certain number, and then you reach a certain threshold and causes infection. So for the ladies with a short urethra, that means microorganisms in their perineum, okay?
In that area?
Yes.
So we are talking of the ones that come from
Around
the rectum.
the anal area, yes, the perineum, even in the vagina, they shouldn't go in. Once they're introduced, then they can easily cause infection. So ladies are at a higher risk. Ladies, because of the monthly hormonal changes, monthly periods, that also dips their immunity. So again, between contamination and colonization and infection, if the immunity is so good, it can sort out the infection. But the ladies, because they have the cyclic hormonal
changes in the hormones, okay.
that predisposes them further. And again, the ladies during pregnancy, again, the hormone changes cause problems.
I think at this point it is important to talk about, of course, when we talk about the cleaning, because the way women, because men, the urethra comes out of the penis. But unlike men, in women there are three openings. We have the vagina, we have the urethra, and then we have the anal area, the anus, for lack of a better word. So when we are telling women to clean themselves after defecation, because now you're talking of contamination, organisms from one part getting to the other part. In order not to contaminate the bladder, which direction should the cleaning be?
They should begin from forward going backwards.
Okay, begin forward going backwards.
Backwards.
And this is important to teach to young children also.
Young girls.
Yeah.
Because the organisms in the vagina are not likely to colonize the rectum.
Yes.
The rectum is hardcore. It has seen the worst.
It has been through
But
hard things.
the anal region, the perineal region, has got E. coli, which if introduced in the vaginal area and the urethral area in large volumes during a wipe, those volumes will be so high, the body cannot take care of them. They will colonize and cause infection. Yes.
That's important. And I think we also now at this point, Dr. Frank, I want you to tell us about this overrated, you see we get parents in schools that start writing all over the place and blaming schools that their children are getting UTIs, UTIs, UTIs from the dirty school toilets or from public toilets. I come up with I have a UTI, then I say, oh, I visited a public toilet. What is the relationship between public toilets and the UTIs?
Yeah, but before I get to that, if you can finish off the contamination, for my colleagues who like doing anal sex, so the penis goes into the anus, and then in the same breath goes into the vagina, you are contaminating her, okay? Then you stick it in the mouth, and you bring it back into the vagina. You are bringing organisms which naturally reside in the mouth into the vagina. That is the cause of UTIs. Before you go to the toilets,
okay,
that's where we're getting most of our UTIs from.
I hope everybody has had this.
Yes.
You're moving one organ from place to place. It is
yes.
like changing parties all the time.
Yes.
It is very dangerous.
So now to the overrated.
Yes.
You have to have a significant contamination. So unless you sit on a toilet and whatever is in the toilet is so dirty and splashes into your organ. But if you just pee, the normal pee, and during the pee, the flow of the urine in this direction washes and keeps away whatever was supposed to come. So it's a little bit, it's possible, theoretically, but the volumes need to be so big. For our ladies who are endowed in size, you sit on a toilet and your members reach everywhere, yes, there's a possibility. But if you are, a good size, and you can remain hanging and dangling on the top, you are safe.
Okay.
And for the men, please don't even go there, because when you stand and shoot, nothing is going to walk back on the stream of the urine to contaminate you.
Splash.
So for the men, again, unless you're drunk,
that you dip your organ inside
the bowl, however dirty that loo is, you are not telling us the truth. You dipped your dick somewhere else.
And got the infection.
And got the infection from somewhere else.
So now we know. So I think you have had toilets unless you get a splashback, or for women, you're well endowed that you have some members that are dipping inside the toilet, but we shall not go that far. I have a close patient. She has not gone to public toilets. She has not done anything, but her urine cannot come out. But this followed surgery. What would surgery do to get someone with a bladder condition?
So the other risk, the condition we talked about of a neurogenic bladder, the risk factors are abnormalities of the spine. We've got spina bifida, or surgeries either on the spine or the brain, or the spine basically. So when the innervation is affected to the bladder,
the nerves okay,
are affected. That means even if the signal from the brain is saying that you empty, it will not reach to completely squeeze the urine out. Or when the signal is sent that relax the muscles, the sphincters, it will not reach. So the sphincters will either not open or the bladder will not contract. So again, if you can quickly go back to the diagnosis, there's a test called the urodynamic test, where we should be able to differentiate in the neurogenic bladder. Are we dealing with a bladder atony? Are we dealing with a sphincter dyskinesia? What are we dealing with?
Okay. But why is the urine not coming out?
Yes. But so the risk in neurogenic bladder, one of the manifestations is stagnation of urine, inability to completely empty the bladder.
Dr. Simwe, we know there's something that happens in the honeymoon where the bride comes out with an infection of the bladder. What is this thing that happens?
Yeah, it's a very well-known phenomenon called honeymoon cystitis. It is all down to what we're talking about, contamination, colonization, and infection. Honeymooners are very excited to have sex, not once, not twice, multiple times. Sometimes they don't clean up in between, and sometimes they are all over the place. So the risk of contamination is extremely high, and that initial exposure unknown. Hopefully, maybe they've never met before, maybe they have met, but the frequency and the being all over and the inoculation and the re-inoculation without giving time the body to fight whatever has been inoculated leads to
whatever
colonization.
Has been put in there.
Yes.
Okay.
And
so,
then you get infection.
So honeymooners, I think this also goes beyond honeymooners, because we know that in this recent generation that people get into this weekend mood and get inside the house and don't come out and are having sex after sex after sex and not cleaning up in the kitchen, in the bathroom, on the floor, on the car bonnet and everywhere. You are being predisposed to, you could easily get cystitis. You're at high risk of getting bladder infection. And when you get bladder infection and you come to the hospital, tell the truth. We talked of cancer of the bladder.
Yes.
What are the risks that predispose people to cancer of the bladder? Is it a common cancer that you see?
Interestingly, it shouldn't be very common and should be a disease, again, of the elderly from the 60s onwards. But interestingly, we're seeing many cancers now in the young. We're talking of 30-year-old, 35-year-old, 40-year-old. And it's very surprising. But the common predisposing factors include working in factories, rubber factories, chemical factories, painters, people who work on tires.
What do these do to them?
There are chemicals, amines, which trigger changes in the mucosa of the bladder and cause to have to change from the normal cells. You know, cancer cells are they are mutations of normal cells. They just change.
The normal cells change from that.
So these chemicals are known to be carcinogenic. So paints, some chemicals.
But if
rubbers.
I'm a painter or I'm working on tires,
yes.
How is my bladder involved? Which is how does it get in contact with these chemicals?
Oh, through the skin, through inhalation. As long as it gets into the blood, it goes to the right place eventually.
The bladder is waiting for it.
Yes, it's waiting.
And then we know that some farmers too get cancer of the bladder.
Farmers, one, bilharzia, those who work like the rice planters who work in water,
Or wetlands and swampy areas.
can get bilharzia, schistosomiasis, schistosoma hematobium, puts its over its eggs into the bladder, mucosa, submucosally, and there's very intense inflammation in the bladder. Over time, that changes and causes cancer formation.
Okay, so
but
we have these
agrochemicals.
Okay, or the ones that are used now as pesticides?
Yeah, pesticides, fertilizers, all those, they can cause cancer
of the bladder.
But of course, we'll be talking about prevention. You don't have to stop using them, but you can protect yourself from them.
From them, okay. But what you mentioned about people who farm in wetlands,
yes,
we have these germs that will come and enter the bladder and cause, like you mentioned, a big infection,
yes,
and change the bladder. Yes. But then we also have the usual, the smoking,
yes,
the drinking alcohol, eating badly.
Yes.
If you're eating westernized food, which those westerners have now left and are now eating our food, you're talking of, you're eating processed food, you're eating sausages, you're eating ham, you're eating these macaroni, things that are not our natural diet. You're being predisposed to non-communicable diseases, and cancers are part of this.
Yes.
So when we come back from our break, we shall see how we investigate. How do these doctors, the urologists, or any other health facility check and decide that you have a condition that is affecting your bladder, and how do we manage it? So stick to the Doctalk show. Remember to follow us on our social media platforms and subscribe to our YouTube channel.
You are watching the Doctalk show.